네, 계속해서 이번 시간은 쿠바 국립신경학 및 신경과학연구소 국가뇌혈관질환위원회 하비에르 비센테 산체스 로페스 위원장님이 허혈성 뇌졸중 후 치료에서의 쿠바산 폴리코사놀이라는 주제로 발표해 주시겠습니다. 이번에도 발표 자료가 비공개인 관계로 책자가 아닌 화면을 참고해 주시면 감사하겠습니다.
Good afternoon. Thank you very much for the invitation. It's a big honor to stay here. My name is Javier Vicente Sánchez López. I am working in the Institute of Neurology and Neurosurgery in Havana. I am a medical doctor and working in critical care too. We talk about Policosanol in post-ischemic stroke therapy. Well, this is the most important aspect in this moment in the world, atherosclerotic disease, a big problem. Atherosclerotic disease produces main cause of adult morbidity and mortality. First, coronary heart disease, cerebrovascular disease, and peripheral artery disease. This is very important because it's the first cause of disability in the adults. It's the second cause of dementia. Vascular dementia is the second cause after Alzheimer's disease, and the third cause of death. Gold medal, silver medal, and bronze medal. It's very sad, this horizon, very, very sad. A stroke results from the sudden interruption of the blood flow to the brain region that impair the energetic supplies to the central nervous system. 28% of patients with a stroke are under 65 years old age in young people. The stroke occur in young people. And this is very important, and this is very sad. When we see the patient, I am doctor, medical doctor, and we see the patient can't move any part of the body, or can speak, or can see, it's very sad to see that. This is the stroke, and we see the most important aspect in this disease. Wait. Only 10% the patient have a stroke have full recovery. 25% minor disability, 40% moderate disability, 10% major disability, and 15% go to the death. Only 10% full recovery. Look, this patient has vesically for all the life. The type of the stroke, two types of stroke. Ischemic stroke is the 85%, and hemorrhagic stroke, 15%. This is the most common stroke. When blocked, ischemic stroke or damage, rupture, hemorrhagic stroke in blood vessel. Here is the modifiable and non-modifiable risk factor for a stroke. Non-modified risk factor, the age, gender, race, ethnicity, family history of stroke. We can do nothing here. But in the other part, modified risk factor is the most important aspect. The first, hypertension. Many people are hypertension. Hypertension produces a stroke, ischemic stroke, and hemorrhagic stroke. Cardiac disease, diabetes, hyperlipidemia, cigarette smoke, alcohol, drugs, and lifestyle factor, for example, obesity, physical activity. This is the most important point. If we can to change the future, we need to work in this part, in modified risk factor of this disease. When these factors, a combination of this risk factor will increase the risk of a stroke. For example, the patient hypertension, diabetes, smoke, alcohol, well, the risk increase when the patient have more than one factor or risk factor. Ischemic stroke treatment. The first in the treatment is fibrinolytic therapy in the first 4 hours, time is brain, or thrombotic mechanic. But the first is fibrinolytic and use antiplaque therapy. The most important drug is aspirin. It's the first. We can use clopidogrel, dipyridamole, cyclopidina, but the first is aspirin in the guidelines of the work. Goal of hospital care after ischemic stroke were monitoring for neurological complication, diagnosis evaluation, restoring therapy, nutrition therapy, physical and occupational therapy, speech therapy, very important, prevention of the medical complication, prevention of the future ischemic stroke, secondary prevention, very important, antiplaquette therapy, lipid therapy, antiplaquette and lipid, blood pressure control, very important, because the high blood pressure is the first risk factor for the vascular disease. Management of diabetes mellitus, lifestyle modification. It's very easy to say lifestyle modification, but it's very difficult to modification. The patient don't smoke, no alcohol, practice exercise. It's very difficult. It's very light to say, but it's very difficult to do. Depression and disease planning. Look, the first step, the first point, the first level, save and recovery. Improve stroke outcome, reduce the disability. Save the human life and recovery. And the second point, prevent. Prevent a first stroke is primary prevention. Prevent a recurrent stroke is secondary prevention. This is the most important aspect in vascular disease, in cerebrovascular disease. And prevent a stroke, we need to change the lifestyle. For example, no smoking, no alcohol, practice exercise, keep the blood pressure in normal. This is very important. If we don't working in this part, in the risk factor, in the modified risk factor, we never change the future. Aspirin is the first line in the treatment, antiplaquette in patients with a stroke. We know other, clopidogrel, dipyridamole, ticlopidina, and other. We have in Cuban Policosanol. Cuban Policosanol, as Professor Sarai said, is a mixture of a molecular weight primarity aliphatic alcohol from Cuban sugarcane wax with lipid-lowering, antiplaquetic, and antioxidant effect, demonstrated in experimental and clinical trial. This is the mechanism. Professor explained that. Look. Preclinical evidence of policosanol vascular benefits. Well, reduce HDL, reduce total cholesterol, increase HDL, reduce platelet aggregation, increase prostaglandin, reduce thromboxano A2, very important, reduce lipid peroxidation and LDL oxidation. This is very important in preclinical. In preclinical evidence of neurological protection, we have a study in hippocampus. Hippocampus is a very important part in our brain. Our memory is in our hippocampus, in cerebral cortex and in cerebral cortex. This is the most important neuron in our nervous system. Look this study. Protective effect of a stroke in a stroke model in animal, in Mongolian Gerber. This picture is normal tissue. This is an animal with a stroke. Look at the stroke shown here in hippocampus. When we use policosanol, 100 milligrams per kilogram and 200 milligrams per kilogram, change the history. Look, we can recover this tissue, and this is the most important. This is very strong evidence in animal experience. Look, and at the end, recovery. Effect of policosanol on stroke. Clinical evidence. This is the most important. Not in animal, in clinical. Clinical, at the end, is the truth. Well, we use patient with we have patient with a stroke, and we use this scale, ranking scale, the modified ranking scale, one of the most important scale in neurological work. The first study was a randomized double-blind study in ischemic stroke of platelet aggregation. 92 patients, 2 groups, is double-blind. One group, policosanol plus aspirin. Policosanol, 20 milligrams per day. Aspirin, 125 milligrams per day. And the other group, aspirin plus placebo. 92 patients, very similar to group, and this is the result. Look the outcome of the group of the patient policosanol plus aspirin. At the first 3 months, the difference in ranking scale. And at the end of the study, 6 months later, the group of the patient to take policosanol plus aspirin, the outcome was better than the other group. This was the first study with policosanol in a stroke in our country. We feel very happy, very glad with this result. Look in the ranking scale, the patient to take policosanol plus aspirin go to the other level at 3 months. 6 months, all the patient moved, get better. The outcome was excellent with policosanol plus aspirin. Effect on the lipid profile and endothelemia in this study. Policosanol reduced LDL cholesterol, reduced total cholesterol, increased HDL, and reduced endothelium. Very important, this lipid profile. When we use policosanol, remember, combined with aspirin. Effect on the platelet aggregation, arachidonic acid, ADP, and collagen was very good too in group with policosanol with aspirin. We made a second study, again, randomized double-blind study in ischemic stroke and oxidative variables. The same, in this study, 61 patients. One group take policosanol plus aspirin, and the other aspirin plus placebo. Look the outcome with when we apply, in this case, the ranking, modified ranking scale. The patient to take policosanol plus aspirin was statistically significant. The outcome was excellent in this group. Look, change the level to get better. And the effect of lipid profile, the same that in the other study. Reduce HDL cholesterol, reduce total cholesterol, and increase HDL cholesterol. Effect on oxidative variables was very good too, in lipids and in protein. In this picture, we can see the group to take policosanol plus aspirin. The outcome was excellent. Look the change percent with the other group to take only aspirin. Third study, randomized double-blind study to compare policosanol versus atorvastatin. Two groups. Atorvastatin is very good for the cerebrovascular disease too. Both groups, similar evolution. In this study, we use ranking scale, but we use Bartel scale, Bartel Index, another important scale in neurology. And was the same, the two groups, the evolution, the outcome was excellent. But the difference is here. Policosanol plus aspirin in high-density lipoprotein increase the high-density lipoprotein. Statin not increase HDL cholesterol. And policosanol increase was significant and was the difference in this study. Other study in long-term randomized double-blind study in functional recovery, 1 year, 12 months, the two groups of patients. One group of patients take placebo plus aspirin, and the other policosanol plus aspirin. Again, the same result, statistically significant, the outcome of the patient to take policosanol plus aspirin. And in the effect of the lipid profile in 1 year was this: reduce total cholesterol, reduce LDL cholesterol, and increase HDL cholesterol in human being, not in animal. All those studies in human being, in patients with a stroke. In all of these studies, look, for a student, policosanol increased HDL 10.5%, 9%, 12.7%, 10%. In all of the studies, increased HDL, decreased LDL, and decreased total cholesterol. Was similar in all of these studies. Remember, randomized double-blind study, one level of evidence. And we made other studies, but open study for 5 years, 16 months, take policosanol, the patient 20 milligrams per day with aspirin for 5 years. And we found this. In this study, we use Canadian neurological scale, other important scale in neurology. The outcome of the patient during 5 years, 60 months, was excellent. But the most important is this was in 50 patients. But look, 40 patients, no new event, secondary prevention. Only one patient have a new stroke. Very important for the future of the patient, because when the patient have one stroke, it's very possible to repeat the stroke in a few months after that. In our study, not repeat when we use Policosanol, and reduce total cholesterol in 5 years. All of these studies are very, we feel very happy when we see this and when we see the patient recovery, when we see the patient come back to the life. Policosanol, we know in clinical trial, reduce HDL and total cholesterol, increase HDL, neuroprotection in our hippocampus, inhibit the lipid peroxidation, HDL, improves plaque composition, reduce plaque aggregation, 2 important effects, in lipids and in plaque. All of these reasons produce anti-atherosclerosis and antithrombotic effect, and at the end, potential vascular benefits. In the other hand, long-term safety is older people, and long-term safety in middle-aged people. These results are very good for us. We have another natural product can help in the treatment of the patient with a stroke, and maybe doing the patient with vascular disease, coronary disease, peripheral disease, kidney disease. For this reason, we say time is brain. Says our neuron is the most important. I am working with Policosanol for 30 years. I began in 1993, 30 years old, working every day in my hospital with patients with a stroke. And for me, I feel very happy when I can say, when I can return the patient, recover the patient. This is very important for me. It's the most point or the most important part of my life. This painting is the little bug. Look. Oh, please. Thank you. Look, this person lost the heart. Other person waiting for a miracle. But in this part of the little bug, this person continue struggling for the life. We need to start in this part in our life, continue to try to open a new door, open a new treatment, try to find a new treatment for try to patient with a stroke and with vascular disease. Thank you very much for your attention.